In certain provinces in Canada, if you need a spinal operation and the operating rooms are closed in hospitals, as they were during COVID, you can't buy that operation. And in British Columbia, a man is now reduced to a wheelchair for the rest of his life because of that. Christine Van Geyn is with the Canadian Constitution Foundation. She joins me right now because I want to learn more about this. Why is there a law which prevents you from having an operation which is necessary and the state can't provide for whatever reason?
So these laws in British Columbia, is the Medicare Protection Act, prohibit in practice the ability of physicians to run private medical clinics. But private medical clinics, independent, non-government medical surgical clinics, have existed in that province for more than 20 years. And those clinics have existed without any compromise to the public government healthcare system. And a lot of people would rather go to these independent, non-government clinics because the government clinics have you waiting on lists for up to years past the medically acceptable wait time.
So what's the political argument? I know there's an NDP government in BC. They're saying that everybody should have to wait, but what if you actually need it? What about this case where someone needed it and they couldn't get it, and now the rest of their life is ruined?
Yeah, so in Canada, we have this sort of ideology of mediocre healthcare for everybody, that everyone needs to wait and suffer equally.
But it's pretty good. Maybe it should be great healthcare for everybody.
I mean, to say it's pretty good for, in the case you described, which is a pediatric patient, a child who needed a severe curvature of his spine corrected. He was forced to wait more than 2 years past the maximum medically acceptable wait time. Because of the delay to his surgery, he's now in a wheelchair for life. His surgery, if it had been performed earlier, did not carry the same risks that it did when it ultimately happened.
So this case is on appeal now to the Supreme Court of Canada, and the foundation of which you belong to is supporting the appeal.
We're appealing to the British Columbia Court of Appeal. Right now, there's just been a trial level decision which found that these laws, which restrict patients from choosing how to access healthcare, are a violation of their constitutionally protected right to security of person. But the court said that that violation of your bodily integrity is consistent with the principles of fundamental justice. I don't know how you could tell a boy who's now confined to a wheelchair for life that it's fundamentally just what happened to him. It's fundamentally unjust.
Right. Sounds like that to me, but there's lots of arguments. We only have 3 minutes. We'll be following this one when it does go to the Supreme Court. Christine, thank you very much.
Thanks for having me.
Thanks for watching. Parliament is coming back. A lot of big public issues coming up, and we're going to be covering them all here. So please subscribe to the show. There's a button right up here on your screen.